Welcome back to the channel. My name is Fumilola, a double board certified pharmacist and mom of two. I am on a life's journey, a journey to discover myself, and the journey is going pretty well if I do say so. If this is your first time here, we talk about everything basically that interests me, and I think might interest you too. If you like watching my video, please remember to subscribe, remember to like, and remember to share the videos. Okay, let's get into today's topic. So, this is the month of November, and we have been talking about weight loss surgery. I've been focusing on gastric sleeve surgery. If you watch the earlier videos, you see where I talked about the different kind of surgeries and how to decide which one that you want to do, and how to decide if you want to do it. So, before we get into it, remember to subscribe and remember to hit the notification button. Let's get into it, guys. So today we're going to be talking about adjusting to your new normal after weight loss surgery. This is like 4 or 6 months onwards. Because it's such a broad topic, I'm going to pick two things that are very prevalent in adjusting to your new normal after weight loss surgery. Of course, we've talked about in the earlier videos, we've talked about stuff like you emotionally settling, struggling with financial, mental, physical issues after the surgery. So today I'm going to talk about two things that are very prevalent after weight loss surgery. The first one is called dumping syndrome, and the second one is constipation. I think it would surprise a lot of people how much these two things would impact you after your weight loss surgery. So let's talk about it a little bit. The first one is called dumping syndrome. I'm just going to read definition. When food moves too quickly from your stomach to your small intestine, it leads to a range of symptoms, which is why it's called the syndrome, right? Because it's a whole range. There's two phases. There's the early onset that occurs 10 to 30 minutes after eating, and then there's a late one that occurs like 1 to 3 hours after eating. So some of the symptoms that you might feel are stuff like nausea, abdominal cramps, diarrhea, dizziness, a rapid heart rate, flushing, tachycardia, bloating. That's if it occurs early. If it occurs later, sweating, weakness, confusion, hunger, palpitations, and you just generally feel like you want to be comatose. You see that comatose one? We are here for it. Anyway, so usually this happens when you eat and then the food moves too quickly. You feel sick, basically. It's not even really about the volume of food you eat sometimes. Sometimes you eat a small amount of food and it just passes room. So foods that are quick to digest or foods that move quickly will give you this problem. So of course things like candy, soda, juice, high sugar stuff, especially simple sugars, will definitely give you this problem. Foods that delay too much as well, might worsen your symptoms. So because they overwhelm your digestive system a little bit. So high fat foods, fried foods like sausage, bacon, creamy sausage, cheese. I was still telling my friend the other day that when I eat ogbono, it's as if it's sludgy and just dragging and just slowing down my digestive system. So yeah, food like that. So refined carbohydrates, they digest too quickly, they mimic sugar to high effect, so they'll also give you dumping. So like white bread, white pasta, white rice, crackers, stuff like that. If you eat large meals, first of all, if you eat large meals after a weight loss surgery, even if it's 6 months after it, dumping is the least of your problems. You're going to be so uncomfortable, you're either going to throw it up or you'll just be uncomfortable until the food moves. And you can literally feel it move like this through your digestive system. So yeah, how long it takes is how long you're going to be in discomfort for. So some of the foods that you don't even suspect that but still give you dumping are foods like grapes and bananas, because they're high in sugar. Whether they're natural or not, the sugar content is real, so you need to be careful. So honey, and then for some people, like if you're lactose intolerant like me, milk, cheese, butter, ice cream will still give you the same effect for the dumping. Caffeine and alcohol will irritate your digestive system and may probably make dumping symptoms worse, so we also want to avoid it. Now, I've talked about all the bad things. I'm just going to mention a few good things. So low sugar fruits like berries, apples, pears, and then you can use sweeteners in moderation. Complex carbs like whole grains, like rice, quinoa, barley, of course. Lean proteins like chicken, legumes, turkey, fish. Low fat dairy, if you tolerate it, are good for you as well. And then high fiber foods, not too high in fiber, because if you're going to eat something that the fiber is too high, it's going to drag through your digestive system. And believe me, it's going to be terrible. Yeah. And then healthy fats like avocado, olive oil, and nuts, right? So the biggest factor when it comes to dumping will be moderation. It's these foods that are likely to give you dumping a little bit. Even the ones that will not give you dumping, you still want to be careful with it, right? So moderation is actually the key to preventing or reducing dumping syndrome. So even for the foods that we believe will not give us dumping, we still want to eat them in little bits. And yeah, so we'll just talk about some tips now that will be able to help in food preparation to try to reduce food that gives dumping. Okay, so yeah, of course, you can do herbal teas, water, non-alcoholic beverages, not pop. Non-alcoholic beverages, do them in little bits. So some of the tips that we're going to talk about: you can grill, you can bake, steam your protein instead of frying to reduce that, that high fats from frying of foods. You can plan for your meals, 3 meals, 3 snacks throughout the day. Large meals can trigger your symptoms. Like I said, everything is in moderation. So if you plan for your meals, small meals, small snacks throughout the day, it will help you feel full for longer, and you won't feel like you're depriving yourself. Because apart from hunger, there's also the psychology of eating, right? So you also want to make sure that you're fulfilling that. Eat fruits with a source of protein or healthy fats to slow down your rapid digestion. Like you can eat apple plus peanut butter, apple plus almond butter, something to just to slow down the digestion a little bit, but not to drag it like high fatty foods like we talked about. So make sure you're sipping your fluids throughout the day instead of like trying to gulp down large quantities. You can't even gulp down. What am I saying? Make sure you're drinking your fluids. So little sips throughout the day. Have like a giant cup. You can with or without a straw. Little fluids throughout the day helps keep you hydrated, and also helps to make sure that you're not trying to down water to try to meet your daily routine. Okay. So chew your food slowly. Small bites before swallowing. Chew them thoroughly. Chew them thoroughly before you swallow. You get why? Now who come go know? Anyway, avoid high temperature foods or very cold foods and drinks. Rest after eating. Relax. 15 to 30 minutes. Don't drink water with your food, or don't eat food with your water. Space them out 15 to 30 minutes apart. It will help to slow down the movement of your food, and it also help you feel less uncomfortable. I think that's the only way I can describe it. Feeling like this gas trapped. Keep a food diary if you can. It will help you identify what is triggering your dumping syndrome. Okay, so I think that's enough of dumping syndrome. We should talk about constipation now. So why is constipation a problem post weight loss surgery? You don't have enough bulk, you're not getting enough liquid or enough fluid, you don't have enough fiber intake, your physical activity is reduced, you are downing multivitamins that include calcium and iron, you're also eating more proteins because you're trying to catch up on your proteins. These are recipes for constipation. So some people are also on pain medication, right? So these are recipes that actually cause people to have constipation. How can we resolve this issue? And it's a really bad issue because you can constipate at 5 days, 7 days. Like, it's really bad. And a lot of people also eat low fiber foods because they're kind of easy to digest. Sometimes dairy products can make you constipated. Red meat, like I said, protein, fried and fast foods can make you constipated. Unripe bananas, processed meals, caffeine and alcohol in excess can lead to dehydration. Remember I said when you don't have enough fluids as well, you can be constipated. So what are the things you can do to help? Fluid intake, little bit of sips throughout the day, just like I said. High fiber foods, consume them in little bits to prevent dumping, because even though you need it, you have to eat it in little bits. Regular physical activity that will help bowel movement. So like I said, there's like a ton of things to talk about adjusting to your new normal. But today, dumping and constipation will just be our, there's a ton of stuff. There's dehydration, nutritional deficiency, losing your hair, loose skin, emotional and mental struggles, food intolerances, weight regain is actually another thing. But we're not talking about this today. Those will be for yummy stuff later. I believe that our fourth video on this series of weight loss surgery will be 5 things no one tells you about bariatric surgery. Yeah, that should be the next video. I think I have it all, not all prepped, but prepping basically. Thank you guys for watching. I always appreciate your time. I don't take you for granted. I will see you in my next video. Also, my hair is growing. Bye guys.